Like and subscribe and click the bell icon to get new video updates.
Young cardiac patient Ksenia Borodin embraces her life while she hopes for a heart-lung transplant on bad days. Ksenia Borodin gets exhausted just getting out of bed and walking the few meters to her kitchen. Ksenia Borodin was born with a large hole in the center of her heart and problems with the valves that control blood flow. She avoids stairs as much as she can, and sometimes even talking leaves her breathless. At just 22, doctors have told her a heart and double lung transplant is her only option for long-term survival. But the part-time Brisbane law student, who was born with complex heart problems, says she has never felt like giving up amid a lifetime of near-death experiences. "I just kind of go along with my day," she said. "I just think, if it is meant to be, it'll be, and, if I am going to go, I'll go. None of us makes it out of here alive. We all have to deal with our own mortality at some point, and I've just had to deal with it at a young age. In a way, I am lucky to be able to accept that because I think a lot of people are terrified by it." Mater cardiologist Mugur Nicolae said Ms Borodin was born with a large hole in the center of her heart and problems with the valves that control blood flow, a condition known medically as a complete atrioventricular canal defect. Instead of having a 4-chamber heart, she essentially has a 2-chamber heart, Dr Nicolae said. The condition results in extra blood flow to the lungs, forcing the heart and lungs to work harder than usual. Breathless all the time as a 19-month-old baby, Ms Borodin had surgery to place a band around her pulmonary artery, diminishing the blood flow to her lungs. The band is still there and, unfortunately, she has outgrown the band, Dr Nicolae said. That band has become so tight now that it is causing severe narrowing of the pulmonary artery. At the same time, her heart has enlarged and she experiences frequent abnormal heart rhythms. She is breathless all the time. Her lung function is very poor, Dr Nicolae said. "We are left with only the hope that she can have a heart and lung transplant. Not all patients are deemed suitable for a transplant, but after rigorous assessments at the Prince Charles Hospital in Brisbane, home of Queensland's only heart-lung transplant centre, Dr Nicolae is hopeful Ms Borodin will be placed on the waiting list for donor organs sometime this year. Because of her petite size and her O-negative blood type, only found in about 9% of the population, she may have to wait up to 2 years for a suitable match. Hopefully, we'll be able to get her through this next 2 years until she gets her transplant," Dr Nicolae said. But there are no guarantees. Dicey times earlier this year, Ms Borodin was admitted to the Mater private hospital's intensive care unit, with her heart specialist admitting he feared for her life. "A couple of times were dicey times. She was very, very sick," Dr Nicolae said. Until she receives the call that matching donor organs have been found, Ms Borodin has a lot to live for. Her older sister, Rebecca, is due to give birth in August and she is excited to meet her niece or nephew. She has tickets to a Yungblud concert in July and is hopeful of catching up with the British singer again after meeting him when he was last in Brisbane in 2019. "I've been to a lot of concerts and any time one of my favorite artists is coming, I am always like, I am going to buy tickets. I could be dead tomorrow," she said. "I just live my life as if there is no tomorrow. Just make the most of every single moment. I think in some ways, it is the best way to live and go about things." In visible disabilities long term, the part-time worker at a Brisbane law firm hopes to finish her law degree. She is also passionate about fighting for the rights of people with invisible disabilities after being verbally abused herself when parking in disabled car spaces. "I have a disability pass and I genuinely have disabilities," she said. "I will park in a disabled spot and just get verbally assaulted. People will be like, 'You're not even disabled, you can park there.' I'll try to explain things to them and I just get scoffed at. That is really difficult and I feel like there is a lot of ignorance around it. I am kind of, I guess, wanting to talk about it a bit more because I feel like I have nothing to lose now." Don't assume her message to people when they see someone who is not in a wheelchair using a disabled car space or a disabled toilet is, don't assume. Only 4.4% of people with a disability are actually in a wheelchair, she said. It really frustrates me when I hear the type of discrimination thrown around to people who don't look sick or disabled. As a teenager who was bullied at school, Ms Borodin tried to conceal her illness behind makeup, using lipstick and nail polish to mask.